Thank you for your interest in Building Your Medical Home, an Introduction to Pediatric Primary Care Transformation, an online resource guide developed by the National Center for Medical Home Implementation. The National Center for Medical Home Implementation is a cooperative agreement between the American Academy of Pediatrics and the Maternal and Child Health Bureau and the Health Resources and Services Administration. The Building Your Medical Home online resource guide provides direction, resources, and tools to pediatric medical home clinicians and practices seeking to advance their knowledge and understanding of the medical home concept as it relates to practice transformation. This video will provide you with an overview of the online resource guide. After viewing this video, you will be contacted by the National Center for Medical Home Implementation with a request to complete a short evaluation survey. So let's begin with an overview of the home page. To access the resource guide, type in the URL www.pediatricmedhome.org. The home page provides the user with an overview of all the sections that comprise the guide. By viewing all of the guide sections, the user can decide to follow the sections of the guide chronologically or to skip to a particular section based on their prior knowledge, needs, and priorities. The guide is divided into 3 sections. The first section is starting the transformation process. This section provides direction to users as they begin their medical home transformation by forming a medical home improvement team, assessing their practice, and understanding quality improvement. Once the user has become familiar with how to begin the medical home transformation process, they can begin to consider how to integrate key functions of the medical home, such as family-centered care, coordinated care, and managing their patient population. Next, users may want to consider how to implement the key functions of the medical home, and they can start thinking about sustaining their medical home by understanding the fundamental principles of medical home sustainability and obtaining resources to assist with sustainability. Next, users can learn from clinicians and families who have been part of the medical home transformation process as they share information about their experiences at the bottom of the home page. And finally, users have the opportunity to provide the National Center for Medical Home Implementation with feedback about the resource by taking a short 5-question survey. Information from the survey will be used to improve the resource guide. So now let's navigate through one of the subpages or sections of the guide. To access each section, click on the section's name or photo. So at the top of the page, you will see some navigation icons. The introduction icon directs the user back to the home page. The transformation process section directs the user to the 3 phases involved with beginning a practice's transformation into a medical home. The key function section of the tool directs the user to information about implementation of family-centered care, coordinated care, and management of patient population. The third and final section is the Sustain Your Medical Home section, which provides an overview of activities required to sustain changes made in practice to become a medical home. Each subpage or section that you click on provides a definition and overview of the topic. Each subpage also contains a sidebar that may include a video or a picture that provides additional insights on the topic of each page. For example, users can hear from pediatric medical home clinicians and families on how the quality improvement process relates to medical home transformation, why care coordination is important to the health outcomes of a child, among others. Each subpage has 1 or more sections that expand and minimize, much like an accordion. When first visiting the subpages, these sections or accordions are closed. This allows the user to review the content of the entire page quickly and easily. Users can click on the plus sign to expand each accordion and access the information within. Each page has an accordion labeled Tools and Resources, which expands and provides links to PDFs, resources, and websites. Depending on the subpage or the sections, additional accordions may be present. To close an accordion, click on the minus sign. Most of the subpages contain a final section which summarizes a take-home message from that page. So now let's review the content of each of the subpages and sections of the guide, beginning with starting the transformation process. One of the first steps in the transformation process is forming a medical home improvement team. This section provides information to assist practices and clinicians with convening an improvement team, which will work to lead the transformation process. It also provides information on who should be a member of the medical home improvement team, attributes of successful teams, and tools and resources. The Assessing Your Practice section. This section provides users with self-assessment tools to identify their practice strengths and weaknesses as they embark on their medical home transformation. Next, users can begin to understand quality improvement. This section identifies quality improvement as the foundation of medical home transformation. A definition of quality improvement is provided, and resources for users to understand the model for improvement are available. This section also has a video that describes quality improvement in the context of medical home. To open the video, click on the image and a box will open up on your screen. To actually play the video, click on the arrow, which is the play symbol, and start the video. To exit the video once you've viewed it, click on the close button in the upper right-hand corner of the screen. So after exploring information about how to start the medical home transformation process, the user can move on to integrate key functions of a medical home within their practice. So each of these sections contain a collection of downloadable PDFs that can be customized by the user, the practice, or the clinician to fit their specific needs. The family-centered care section provides a definition of family-centered care and its benefits for the child, family, and practice. The user can find characteristics of family-centered care as well as customizable tools and resources that have been created by the National Center for Medical Home Implementation. This is an example of one of the customizable PDFs that is available throughout these sections. Each practice or clinician or user can modify each of these sections to make them applicable to their practice. Next, the coordinated care section defines care coordination in the context of medical home. Here, the user will discover information related to coordinating care for children with specialists and the community. The section includes information on how to help connect families with community resources. For example, a community resource list is provided that provides links to national and local organizations that can help families with children and youth with special health care needs. Finally, the user can learn how to manage their patient population. This section provides an overview of patient population management in the context of the medical home. Tools in this section help clinicians and practices to proactively care for and monitor the health needs of their patients. It includes sample registries, care plan templates, online resources for using Excel to assist with patient registries, and the most updated periodicity schedule from the American Academy of Pediatrics. This is an example of one of the action plans available throughout this section. The last section of the guide is Sustaining Your Medical Home. This section focuses on providing tools, resources, and guidance to clinicians and practices to sustain the changes they have made in their practice in order to continue to function as a medical home. Materials in this section focus on achieving buy-in from leadership to continue the transformation process, as well as resources for coding and financing medical home activities. For example, a link to this medical home coding fact sheet is provided. The Building Your Medical Home online resource guide assists clinicians and practices to start and maintain medical home transformation activities. If you have any questions about the guide or require additional technical assistance or support related to pediatric medical home implementation, please contact the National Center for Medical Home Implementation. The contact information is available on your screen. After viewing this video, you will be contacted by the National Center for Medical Home Implementation with a link to an evaluation survey. We encourage you to complete this short survey to assist the National Center in improving the quality of its tools and resources. Thank you very much for your time and consideration.